Hi everyone, this is Neel Raithatha, consultant, audiologist and director of ClearWax. Thank you for joining me in my latest video using the WAXscope. And here we have a patient who attended with a severely impacted plug of wax. Now, this wax plug extends right from the entrance of the ear canal all the way to the eardrum. And it changes in consistency, so more laterally, the wax is quite soft and mushy, and deeper in the ear, the wax is quite hard and solid. So immediately I recognised that I'm going to have to instill some medical grade olive oil spray just to bind this wax together. It was just too soft and mushy to suction. But even then, it is still quite difficult to remove. And in a moment, I think I'm going to use the Correct and the right angle Correct. Now, although the Correct did remove some of the wax, because it was so soft, it did smear some of this wax against the floor of the ear canal. So I'm just trying to separate this from the floor of the ear canal. So probably just past the second bend, you can see to the right hand side that illumination of the flesh. That is the second bend. It's quite sticky. I'm going to go to the back part of the ear canal, I think, as well. Just trying to separate it. So here it's more to the top and this is to the back. But it's quite adhesive. You can see it's almost glue-like. It's stuck to the canal and I'm trying to peel it. And some of it is coming away, but at the same time, the suction tip, it's just indenting into the wax. And instead of removing it and suctioning it. So I've decided just to go to the front part. I'm just having a nosy at the top, thinking where I can glide the Correct. So there's not any space really, but with the Correct we can, because it's got a tapered tip, you can see we're going to glide it over the top. And I'm going to turn the Correct now so we can scoop it out. So a little bit did come away, but you can see it's smeared to the floor. And the deeper wax is, as mentioned, harder. So a bit later in the procedure, I am going to use the right angled ear hook to penetrate into the plug and slowly extract it. It worked really, really well. So I've just reverted back to the suction. So I cleared some of that smeared wax. And the ear canal is beginning to reveal itself posteriorly. So to the left, that's their posterior canal wall. This is their right ear. So the posterior canal wall is going to be the left side of the canal. It's a bit of skin in the surface of the wax. And again, I didn't feel like suctioning was going to get me any further without introducing some more oil. So I used the oil on several occasions actually during the entire procedure. So given the colour of the wax, we know it's been there for a while. The patient advised, it's the first time they visited me, but they said the last time they had their ears cleaned was about 6 or 7 years ago. And just in the last few days, they really noticed the symptoms. You can see there's a few hairs matted. So I'm just trying to separate it from the anterior canal wall now, which I've managed to do. But again, I just feel that it's just a bit too soft, this region. Higher up in the plug is a bit firmer. And what I'm trying to do actually is kind of roll it up, and as I'm rolling it, bringing it forward. So I managed to separate some of the wax from the floor of the ear canal there. Again, I'm just using the size 2 specular. So this is the most common size that I use. It's got the tip of the specular has got a diameter of 4.25 millimeter. We've got smaller specular as well, which I also use quite regularly for narrow pediatric ears. That's got a diameter of 3.5 millimeters. And we got a large specular, 5 millimeter diameter, and an extra large 5.75 millimeter. So now this wax, you can see it's suddenly got a lot darker, especially to the right. This is on the left, it's still some of that softer wax, but now we're hitting the core of the wax where it's much firmer. I'm just giving these little wriggle movements. It's almost, sometimes with wax, you've got to remove it like you're playing Jenga. So even if you don't remove the whole piece, if you remove a segment, it helps, especially if it's a wax plug is right up against the canal wall, it helps to collapse it. So it makes it smaller, which then can facilitate its removal. So again, just to the back part of the ear canal, I'm trying to separate this. But I can just feel there the suction tip gliding against the surface. It's just too rock solid now. Now, this patient did say they used some drops previously, so it could have been the drops softened the outer half of the wax, but it just couldn't penetrate deeper into the wax, hence why it's a lot firmer and harder. If I'm honest, I actually prefer this consistency, the harder consistency. And that's because you're better able to use an ear hook to pull it out, or even the correct. So typically a correct is used for softer wax, but you can also use it for harder wax. And when the wax is firm, it typically comes out in a plug, a single piece, as opposed to segments like it was with the beginning of the procedure with the softer wax. So I think I'm going to use the ear hook now. So I'm just positioning the WAXscope to the roof of the ear canal, the superior aspect. I've glided the hook horizontally. I'm now going to turn it almost like a key, so the tip is into the core. Now initially it just cut through it, but I'm going to go back in again, and you should see it move, the plug move forwards on this occasion. There we are. So I'm bringing it just past the second bend to the right. To the left, that's the first bend. So I'm not quite there yet. The ear canal entrance was a bit narrow, so as I was bringing it away, I think it just got trapped. So just using the correct for some bit more surface area to see if I can leverage it out. And it's slowly coming away. It's broken up into little pieces, and if you watch till the end, I've got a still image of all the wax that I removed. There's a huge plug which is still in the ear. So I thought this piece will be the last piece, so I'm just suctioning it away because it's loose, it's near the entrance. And I thought that was procedure done, but little did I know there was still a tremendous amount of wax there. So this piece, again, was separated, so it came away straightforwardly, if memory serves me correct. So again, I'm just giving this little wriggle movement, trying to tease it out of the first bend. So I think we've still got the big plug. So the amount of wax removed for this patient's ears, it's the typical amount. So this is just the one ear. It's kind of the normal amount I would remove from a typical patient's right and left ear. So it's a tremendous amount. So this is the big plug. I've got a good suction grip. I'm just trying to wriggle it. As I'm wriggling it, I'm navigating the curvature of the ear canal. So as we enter the ear, you see the first bend to the left where the little hairs are poking out. And the ear canal veers off to the left, and then it veers back to the right. So it's a sigmoid shape, an S-bend. So this plug is now visible with the naked eye. And in fact, I don't think I was actually looking at the camera at this stage. I was just shining the light of the WAXscope onto the plug of wax because it was just visible. I'm just trying to get a better suction grip, wriggle this out. And I think we're nearly there. I might use the correct even, let's see. Yeah, I think I'm going to use the correct just to get in and behind this now. There we are. So I'm just pushing the cartilage portion of the ear canal up so I can get in and behind. So you'll see a good still image of that wax alongside all the wax that I removed. So it's going to re-enter the ear. Going to get the eardrum in focus. It looks nice and healthy. Ear canal has a bit of erythema there because the plug was right up against it. So that's all the wax. And that's just from one ear. And that's that big plug that I removed at the end. Well, I hope you enjoyed that video, guys. Take care, keep well, and speak soon. Bye.